In the components of hemodialysis, we have seen one parameter called ultrafiltration. Pertaining to that, one component in the monitor, ultrafiltrate profiling. What is ultrafiltrate profiling? You might have come across a graph, something like this. There are 6 graphs. One is in blue in color, rest all are in white. In simple terms, if I get to tell what is your profiling, is adjustment of the ultrafiltrate rate. When we do, suppose if the patient BP is on the lower side, we want to remove ultrafiltrate. Ultrafiltrate is nothing but water we are removing from the patient. BP is already low, let us take it as 100. During that time we can't remove the ultrafiltrate. We want very minimal ultrafiltrate. As the dialysis goes on, we are expecting BP might improve. Don't ask the question why the BP will improve, because suppose if hyperkalemia is the cause, as the dialysis started moving forward, BP will improve. Okay, let us take an for example. Dialysis started, we are expecting BP to improve. During that time, we can select a graph going down towards higher side. There will be 12 bars. 12 bars will be there pertaining to this machine. Sometimes the number of bars might vary. Pertaining to this machine or most standard type, there will be 12 bars. Basically per hour, if we are giving 4-hour duration, every 20 minutes the rate can be adjusted. In simple terms, water removal from the patient, how much we want. First 20 minutes we don't want water removal. Second 20 minutes we want 100 ml. Third 20 minutes we want 200 ml. Fourth 20 minutes we want 600 ml. Like that you can keep on increasing the upsloping graph. Like that graph you can select. Or sometimes patient is in severe volume overload. In the beginning only you want to remove more. So in the beginning, to start with, in the first hour you want to remove more. Let us take 1 liter you want to remove. So the graph, the initial 20 minutes you will remove more, 400 ml, 300 ml, 200 ml, 100 ml, 20 ml, 0. So the graph will come like this, the down sloping graph. Sometimes you want a stable graph. You want to remove 200 ml every 20 minutes. In between you want to remove more. The graph can be set like that. In between you don't want removal. Let us take an example. A patient developed hypotension during the dialysis. Not to a level a patient is requiring inotrope, but a minimal low BP. For next 20 minutes we don't want ultrafiltrate, and the graph can be set accordingly. The water removal from the patient can be graphically set. Here you can see some downsloping graph. Here initial 3 bars are same, then it is going down. Here initial 3 bars are same, but suddenly it is going down and coming to normal. Suppose if the ultrafiltrate profiling is not done, a particular rate will be removed constantly. Every 20 minutes, 200 ml. It will be constant throughout. Depends on the final ultrafiltrate you fixed. These are the sub-adjustment. When the sub-adjustment will come, once you understand the gross adjustment. In the screen, 1.5 liter is the goal. For the beginner to get, just you have to set only the gross parameter. These are the next level. Next level are those details which is required for a dialysis technologist and the nephrology resident. Ultrafiltrate profiling. Water removal we can adjust. Do we select this for all the patient? Many times we might not, but for a particular case, this minor adjustment will help the patient to be hemodynamically stable. Case to case, we have to decide hemodynamically unstable patient. Many times during dialysis, patient develop hypotension. Those kind of patient, UA profiling have to be done. This profiling word might be confusing to nephrology resident, because many DM juniors used to ask, sir, what is this profiling? You might encounter sodium profiling, bicarbonate profiling, ultrafiltrate profiling. Profiling is a word, I feel that is a word to confuse only. The concept is, according to the time, we are adjusting the rate. Is the graph is fixed? The question will come, is the graph is fixed? For this particular machine, only these 6 graphs are there or what? No, you can adjust this also. Once you touch, there will be entire set of graph bars will be there. This bar you can adjust up, you can adjust it down. The graph you can make also. Whatever the graph the rate you want, you can minutely also adjust. To start with a lower ultrafiltrate, at the third or a higher ultrafiltrate, before closing you don't want to remove. Let us take last 30 minutes you don't want to remove. You can set it accordingly. So this screen I will give it as a background image also. You can go through what are the parameters. Once I touch this, I can start adjusting the individual bars. And once it is done, we will come back to the bar selection where we can select at a particular rate. Most of the situation, a constant ultrafiltrate will be removed. Only in some situations, these kind of graphs we will select. This is all about UEF profiling. UEF profiling or water removal profiling. So this is about today's video. One more component we'll see in the next video. Bye bye.